Hi, my name is Michael Daly. I'm an emergency physician in Albany, New York, and I'm the Regional EMS Medical Director for the Hudson-Mohawk region of New York State. I'm excited to be here today to present to you a new program which will allow basic life support providers in New York State the opportunity to provide intranasal Narcan or naloxone to patients who've overdosed on opiate pain medications. When someone overdoses on an opiate pain medication, they lose their ability to breathe. They become what we call hypoventilatory. They'll become very cyanotic or blue, and they'll be breathing at a rate that may go down to 1 or 2 times a minute. If this is recognized by an EMS provider and Narcan is given, the effects of the drug will be reversed and the patient will start breathing again on their own. This pilot project is a collaborative effort between the Department of Health's AIDS Institute, the Bureau of EMS, and the Albany Medical Center, with assistance from the Regional Emergency Medical Organization, or REMO, and the Harm Reduction Coalition. And people from the regional EMS councils in Suffolk County, Monroe, Livingston, and the Rochester area, the Adirondack Appalachian Regional EMS Council, Mountain Lakes Regional EMS Council, and the Hudson-Mohawk Regional EMS Council have all come together to bring this pilot project to New York. It's our sincere hope that this will allow us the opportunity to save lives where there is only BLS resources or basic life support resources available to our patients. The bottom line on this pilot project is that opioid drugs can make people stop breathing. Naloxone is a safe medication for EMS to use, and giving intranasal medications is easy. Basic EMTs in New York State can save lives with intranasal naloxone. Some of the background of this really has to do with the abuse of opioid drugs despite public health efforts. The most immediate medical complication is respiratory depression. The respiratory depression leads to brain injury from hypoxia and often leads to death. Naloxone is well recognized as being a safe and effective opioid antagonist or reversal agent for opioid drugs. Historically, New York State EMT basics have successfully implemented many pilot projects, including defibrillation, albuterol for asthmatics, EpiPens for anaphylaxis, and glucometry, as well as others. In this case, the risk-benefit ratio clearly favors starting intranasal naloxone for opioid overdoses at the BLS level. What are opioids? These are medications or drugs that come from or are similar to opium. Some are synthetic, some are organic or made from the opium poppy originally, and there are hundreds of different types. Some of these opioid medications, heroin, morphine, fentanyl, which is also known as Duragesic if it's in a patch form, or Sublimase if it's an injectable form, hydromorphone or dilaudid, Demerol, codeine, methadone, hydrocodone, which also comes in other formulations like Lortab and Vicodin, oxycodone that comes in other formulations like Percocet and Percodan, and OxyContin. There are hundreds of other opioid medications. What puts people at risk for overdose? Mixing drugs leads to potential overdose because each drug contributes an effect that's greater when it's mixed with others. Variation in strength and content of street drugs. For users who purchase their medications on the street, these may not be regulated medications, like heroin, where there's no control for how strong it is. Tolerance changes. If somebody goes into a period of abstinence where they don't use medications, or if they're incarcerated or in a drug treatment program, In both cases, they may be leaving the drugs behind for a while and then going back to using them again. This can lead to overdose because they don't expect that they have a lower tolerance for the medication. If people use drugs alone, it increases the chance that they will overdose. And if someone's physical health is deteriorating, either because of weight loss or decreased liver function, they may be less likely to tolerate the same amount of drug that they've used in the past. What follows is a dramatization of a basic life support squad and their first response partners arriving at the scene of an opiate overdose.
Hey, Richard, I got you your meds. Richard? Richard, wake up. Richard. Richard.
911, what is your emergency?
It's my brother. He doesn't look good. I don't think he's breathing. He might have overdosed on something. He's been taking pain meds.
Had this been a real call to 911, at this point, Richard's sister would be getting pre-arrival instructions on what she could do to potentially help Richard while she waits for first responders to get there. This would include attempting to position him as well as he could for breathing, potentially giving rescue breaths, and if it seemed as though Richard might be in cardiac arrest at that point, potentially doing compression-only CPR. That would depend on the professional call takers that are this part of a chain of survival that will help any patient in need.
Hi, we're with the fire department. Can you tell me what happened?
I think he's overdosed. He's not breathing. I don't know how long he's been like this. He's been
Sir?
taking pain
Our first
meds.
response fire department has found Richard to be sitting in the chair and not breathing. They're collecting as much information as they can about what happened to lead him into this condition, and they're going to move him to the floor so they can begin to manage his airway appropriately.
Hey guys, what's going on?
My brother, he hasn't been breathing. He's been taking these pain pills.
Oh.
I don't know what's happening. He's been taking them for a little while. He's got bad back pain.
Alright, pupils. He's got pinpoint pupils. He's been taking hydrocodone. Can we get the Narcan bag? Narcan? So how long has he been taking these?
A couple months now, but
Right.
he's kind of been down lately, so I don't know if he's been good about taking them regular or not.
Okay. Does it seem like he took too many of them?
He might,
or-
yeah, he's been real
He's got
down
pressure
lately.
150 over 90, respirations are 4, and he's got a pulse of 50.
Alright. Yeah, let's get that Narcan. Thanks, guys. You're doing a good job bagging. Good chest rise.
What happens when someone overdoses? Their mental status decreases, their respiratory rate decreases, they may have some seizures from hypoxia. As the brain gets less oxygen, it may cause seizure activity. Ultimately, they will lose respiratory drive and may go into respiratory arrest. And after a respiratory arrest, they may just have a cardiac arrest. It's bad to overdose on opioid medications because of the hypoventilation that I've already talked about. This can also cause hypoxia and hypercarbia as carbon dioxide builds up in the blood and blood oxygen levels decrease. As people begin to become more hypoxic, they may aspirate. As they're breathing less, they may vomit, and that may go into their lungs. The hypoxia will ultimately lead to brain damage and death. Why is it better to get naloxone than not? Bag valve mask ventilation with supplemental oxygen is well tolerated and well trained for our BLS providers. But even though we're well trained in doing this, it still includes the risk of aspiration for the person who's being bagged. If we reduce the duration of the hypoventilation and we give a medication to reverse that hypoventilatory effect, and we get the person to breathe for themselves, there is a better chance for them to have a good outcome. The EMS providers who have arrived recognize that this is an opiate overdose. They're asking for the rescue kit. The rescue kit itself will now be assembled and then will be administered to Richard to help him start breathing again.
Is he gonna be okay?
Still has a good pulse. Does he have any past medical history that I need to know about, or
Just his back last couple
Just back
months.
pain?
Yeah, yeah. Just
from an injury, or?
yeah, he threw it out working, and then lately he's been real down. So
Okay, we're just gonna give him some medicine to perk him up a little bit.
yeah, see if you
Okay, half in one nostril, and half the Narcan in the other side.
Why give naloxone intranasally? Well, everybody has a nose. The nose is a quick, convenient point of access. Mucosal atomizer device that's going to be used to administer this medication is extremely easy to assemble, and the administration takes seconds. It's safe, which is extremely important to everybody at the Department of Health. It's going to avoid the risk of contaminated needle sticks from our injecting the patient. IV access is often very difficult to obtain in opioid users. This is also an extremely effective way of administering medications, and you end up with similar blood levels and effect to drugs that are given either intramuscularly or intravenously.
Keep bagging them until we see some change. You can take that. Does he have any other history of medical problems?
No, not that I know of.
Nothing? Okay. Does he take any other medication besides this?
Nope, just that. Just
Because I saw some other pill bottles over there.
yeah, I think that's the only thing he's taking
Okay.
right now.
Okay. All right.
Okay, good.
What's his name again?
Richard.
Richard. Hey, Richard. Richard. You okay? It's the ambulance. We're here to help you. You passed out a little bit. Can you hear me? That's it. Just take some nice deep breaths. We're going to put some oxygen on you to help you breathe a little bit, okay? It's just oxygen. Okay? Looks like you took a few too many pills.
Back's been killing me.
Your back's been hurting?
What you've just watched was a dramatization of what an overdose might look like from a call to 911. The Hoag's Corners Volunteer Fire Company and the Hoag's Corners EMS were nice enough to participate. If this were a real case of an opiate overdose, very similar events would have occurred. First responders would have arrived, identified that this had been an opiate overdose. They would have begun to take care of the patient's breathing as trained by the state of New York in their EMT program. Then the ambulance agency or first response agency that had the training, additional training in the use of intranasal Narcan, after they identified that this was an opiate overdose, would have administered the drug. The patient then would have recovered the ability to breathe. This is the Narcan, or Overdose Prevention Rescue Kit, that will be given out to basic life support ambulance crews in New York State as part of this pilot project. It'll include a mucosal atomizer device, which opens like this and comes out and is kept clean in the plastic container. It also includes 2 milligrams and 2 milliliters of naloxone. You'll open it up, check the expiration date, which is on the end, and then open the package of naloxone. It's also known as Narcan. Take it out of the package, 2 components, the medicine and the delivery device. You'll take the purple or red cap off the Narcan or the naloxone. You'll take the yellow off the delivery device and screw it in. Then take the yellow cap off, take the mucosal atomizer device and attach it to the delivery device. Screws right in like that, keeping it clean in the packaging. And then is administered by pushing here. This end goes into the nostril. Side effects of Narcan administration can include nausea and vomiting. Can also include seizure if there's some other medications on board. In some cases, the patient may go into withdrawal if they're on a lot of medications on a chronic basis. Common side effects of the administration of naloxone include anger. Someone's just gotten high, and we've taken that high away by giving them naloxone. They don't know they weren't breathing, and that's why you gave them the drug. Other side effects include opioid withdrawal, which can include shakiness and diarrhea, diaphoresis or sweatiness, hypertension and tachycardia. The thing that's more of a concern for us is that it also may unmask other substances that person ingested. You may start with somebody who's almost unresponsive and very hypoventilatory, and when you reverse the opioid, you may see someone who's very intoxicated on alcohol or intoxicated by cocaine, methamphetamines, hallucinogenics, or other drugs that they've ingested along with the opioid. You've got to be prepared for somebody that may not be a calm, quiet, and easygoing patient. These patients may be very, very agitated. Importantly, though, none of these side effects is worse than a patient not breathing. Giving Narcan has the potential to get a patient who is not breathing to breathe again and save their life.
Dr. Daly, can you administer Narcan if you don't know what they took?
Yes, but you should be pointed towards the fact that it's an opiate. Something should give you the information that the person has an overdose that you'll be able to reverse. Pinpoint pupils in an unknown overdose without breathing, all right, or with very little breathing, that would be a sign that this is likely to be an opiate overdose and someone that you should use the Narcan on.
Dr. Daly, will Narcan work for a person that is pulseless and isn't breathing?
Billy, actually an opiate overdose can cause someone to go into cardiac arrest, but if they're pulseless, the medicine in their nose isn't going to be circulated through the body and isn't going to help. It's something that may end up being used by paramedics or critical care techs as part of their resuscitation for the patient, but it won't help initially until they regain spontaneous circulation.
How much time after the overdose do you have to administer the Narcan?
Well, we talked about how it won't work in a cardiac arrest, but any patient that's hypoventilatory or not breathing well will benefit from the Narcan if they took an opiate, and that's the reason. So those are the patients that we're going to give it to. They don't have to be breathing at all for the medicine to work, because where it's absorbed is on the mucosal surface of the inside of the nose. It's not absorbed in the lungs with them breathing it in and out. Sometimes there will be some difficulties with giving intranasal medications. If someone's been using intranasal cocaine, it's a vasoconstrictor, and it may prevent some of the absorption of the medication. If somebody has a bloody nose or a cold causing nasal congestion or mucus discharge, it will decrease the effectiveness of an intranasal medication administration. Lack of nasal mucosa, if someone has just had septal surgery or long-term cocaine abuse, may also decrease the chance of absorption through the nose. And if you give any more than 1 milliliter per nostril, it's likely to run off and just roll down the throat and not have any effect on the patient at all.
Does it matter if a person OD'd on a prescription drug versus a street drug like heroin?
It's a great question, Billy. Actually, it doesn't. Both prescription and non-prescription opiate medications will be reversed by Narcan. Some of these medications will require more Narcan than others, but both will work. So common street drugs like heroin will be reversed by this. Common prescription medications like MS-Contin, Vicodin, Lortab, Percocet, oxycodone, all of these will be reversed by the Narcan as well.
Okay.
Can you use this medication to figure out what they did take?
It's an interesting question. In the old days, all right, what we used to do was give a cocktail to people who are altered mental status. This protocol very, very explicitly says that it's not just for alteration of mental status. If somebody is altered, you don't give them this medicine. On the other hand, if they're hypoventilatory and not breathing well enough, then they can get the Narcan. We're not trying to figure out what they took. We're trying to treat their hypoventilation by reversing the opiate that they may have on board.
Would this work on somebody that has consumed a fentanyl patch?
Absolutely. It will work on someone that took fentanyl or took a fentanyl patch. But fentanyl patches have an incredible amount of medication in them. Because it's a long-acting medicine that's designed for application over 3 days, it's got a lot of drug. So if somebody consumes a fentanyl patch, they may have a little bit of a resolution of their symptoms with their initial dose of Narcan. They may need more. So it's definitely a patient, if you have the ability to get more Narcan to the scene, into the patient, or meet other crews who can give you more Narcan, that's definitely a patient that needs it.
What if we give Narcan to somebody who doesn't need it?
So someone is hypoventilatory but has not taken an opiate,
Right.
or someone who hasn't taken an opiate at all and it's a misapplication of the drug. If there isn't an opiate on board for that patient, there will be no effect whatsoever for the Narcan. The patients particularly to watch for, though, are the ones who you can wake up and you can stimulate to breathe without needing to give them medication, who are on chronic long-term opiates. In those patients, either patients with chronic pain from an orthopedic injury or chronic pain from cancer, for example, if you can stimulate them to breathe without giving them the Narcan, please do that, because the goal is to get them to breathe, not to give them the medicine. And if you reverse an opiate that somebody needs chronically, they'll wake up having a lot of pain because you've reversed the effects of the opiate that they were taking. The addition of Narcan or naloxone to the basic EMT program in New York State is an important pilot that will give us an opportunity to save lives throughout New York State. Boston EMS and many other EMS agencies have had BLS naloxone programs for many years. In Boston, they've had hundreds of utilizations of this protocol. They've had no complications for the patients, and most importantly, as the Department of Health and the Bureau of EMS has considered implementing this pilot project, there have been no injuries to EMS staff as a result of administration of naloxone in opioid overdoses in the city of Boston. What about New York? The New York State Department of Health has allowed the provision of naloxone to family and friends of opioid users since 2006 through a buddy care program. This has been profoundly successful at reversing opioid-induced respiratory depression in inadvertent overdose. Currently, under New York State EMS protocols, only advanced providers, critical care technicians and paramedics, can administer Narcan. Intranasal naloxone is a safe and effective way of taking care of opioid overdoses. Basic EMTs can learn and apply this skill easily. This program has a significant potential to save lives in New York State and will be implemented on a regional level through this pilot project. I'm excited that you're going to participate in this program. There'll be additional training to be done on a squad level to practice with the devices themselves. These devices will be provided by the state of New York to assist with your patient care. Each case will be reviewed on a regional basis, and we'll collect that data to bring the information back to the state to assure that this is indeed a program that will benefit the patients in New York. If you require additional information beyond what's been available to you so far, please contact your regional EMS council. Good luck, and thank you for your participation in this important program.